everybody, it's CrystalD RMT here. I just wanted to go over my favorite hip and glute stretches with you today. I often give these for pregnant women experiencing pelvic girdle pain, hip pain, lower back pain. They're also great for anyone who's athletic, who might be running and struggling with some piriformis syndrome, or hip pain in general. Also great for those of you who might have hip arthritis, or any kind of issues going on through the glute hip area. So the first one that I'm going to show you is a basic hamstring stretch, and it's pretty surprising how often people can recruit other muscles or cheat out on this one so that you're not actually stretching the hamstrings. Effective hamstring stretches have two things in common. The lower back and thoracic spine are straight, and you're pulling the hamstring muscles across two joints, namely the hip joint and the knee joint. So to do it properly and effectively, you want to make sure your spine is in neutral, shoulders are back and down, abs are slightly engaged. Raise one leg onto a surface, point your toes towards your face, and what you don't want to do is slump forward. You want to hinge forward at the hips. I can feel this already. So depending on your flexibility, your range of motion, you may or may not stop at this stage. If you can get further, of course, you're always trying to reach for the toes. At this point, I can't. The other thing I'm trying to focus on is shooting my hip bone and my femur back towards the wall behind me so that I'm also lengthening through the hip joint here. And that's about as far as I can get. So I do see some clients reaching all the way to their toes. Well, of course you can if your back's not in proper alignment, but to go forward and actually stretch the hamstrings effectively, this is the position, and I can only get this far. The next stretch is a seated figure 4 piriformis stretch. This is for the deep hip rotators. So again, posture is important, that I want you to be sitting straight up, spine lengthened in a neutral position like this, and shoulders back and down. You don't have to flex them back and down, but just making sure that they're towards the back and engaged as opposed to a rounded thoracic spine. So then you want to take the outside ankle of the hip you're trying to stretch, rest it on the top of the opposite knee, and then from this position apply a little pressure downwards while hinging forward at the hips. So I'm fairly flexible, and this is as far as I can get. I can feel a deep stretch at this point. So when I see some people thinking that they're getting an effective or deep stretch with a rounded thoracic spine, it's definitely isolating the muscles more and more effective if you keep your back straight and hinge forward at the waist or the hips, like that. The second hip glute stretch that I like to give clients is actually a yoga pose. It's the pigeon stretch. So this one may or may not be suitable for you depending on your flexibility. If you've had hip surgery, hip replacement, or if you find that you're just really not that flexible through the hips and pelvis. Also depending on your stage of pregnancy and how mobile you feel. This may or may not work for you, so go ahead and give it a try, but also being aware of your potential limitations to get in and out of the position because it is on the ground. So pigeon pose, you want to start in all fours, hands shoulder width apart, and knees hip width apart as well. The side you want to stretch is the one you're going to move, and you bring that one forward. For me, it's my right side, so if you're stretching your right hip, you bring it forward so that you're actually sitting on the lateral side of the thigh, and then your knee is flexed, your hip is flexed, the outside of my foot is resting on the ground. And then you can lean forward to increase the intensity, or you can go side to side to increase the intensity. The further towards the side you're stretching, the less intense it will be, and the further away from, the more intense it will be. To reach maximum intensity, you fold forward like this. I can only get this far before I'm really feeling an uncomfortable stretch. And then to come out of the position, you put pressure on the leg that was extended behind you. Lastly, but not least, is stretching out the front of the hip. If we've stretched out the back, we've stretched out the hamstrings, and we also need to do something about the hip flexors. So specifically for hip flexors, I do really love a runner stretch. For pregnant mums, I'd like you to have a yoga ball in this space so that you can lean into it and have it kind of catch some of your body weight. For the rest of us, if you are stable enough, you can do it just in this position. If you feel unstable, then you can do it in front of a wall so that you can rest your palms against the wall. So with a runner's stretch, it is, again, coming forward at the hips while keeping a neutral spine position. So I can feel a little bit of a pull already through here. If I want to intensify it, I can reach back and pull the foot towards my bum. From a side position, it's going to look like this. Coming forward, feeling the stretch through the front of the hip, reaching back and pulling that heel towards your bum if you want to intensify it. And really making sure that your core is engaged so that the movement is coming right from the hip and not extending through the lumbar spine. So there you have it. That's my generalized hip glute stretch for pregnant women and really any clients who are experiencing some hip or glute or pelvic discomfort. Depending on their situation, I may or may not add in some adductor stretching. And then as well as some strengthening to balance out those muscles. Often muscle pain is that some aspects of the tissue are tight and other antagonistic muscles are weak. So it's about strengthening the weakened stuff and making the tight things more flexible. So as with all stretches, you do want to stretch both sides, the affected and unaffected sides, so that your body's balanced. And in principle, you're supposed to hold it for a minimum of 30 seconds. I really do prefer if you can hold it for a minute. I feel that that's enough to get past the first tissue tension and allow your body to relax into the stretch. If you have any questions, always consult your doctor or a trusted healthcare provider like a massage therapist, a chiropractor, or a physio. Please be sure to like and share this video. If you have any questions, go ahead and leave them for me in the comments. I will check in and see if I can answer those. You can always visit my website, CrystalDRMT.com, and send me an email or ask questions from there. Thanks for watching. Shoulders, hands and shoulders, hands shoulder width apart. And be sure to like this video so